You're listening to Health Professional Radio. My name is Wayne Buckler and my guest today is Helen Killmier. Now, Helen's a community psychologist and she's a board member of the College of Community Psychologists within the Australian Psychological Society. Welcome to Health Professional Radio, Helen.
Thank you. It's good to be here.
Tell us a little bit about community psychology and how that fits into the health system.
Community psychology is currently only taught in Australia in Victoria at Victoria University. So there's only one pathway at the moment for community psychologists to get the specialist training in applied psychology from a community perspective. It has been run in other states, but at the moment it's only run in Victoria. It's certainly run around the world, so there's community psychology training courses within America, North America, and a variety of other countries around the world. But we're a small section, I guess, of psychology, and we do quite specialist work around looking at needs analysis for communities at risk, community asset mapping of social capital, looking at community-generated problem solving from an assets-based perspective, looking at collaborations on social justice, looking at community capacity building to manage change and address risks and threats and protective factors, evaluation of psychosocial environments, looking at things like sense of community, attachment to place, quality of life, and how our social support networks are a big influencer of our health and well-being.
Now, when I think about psychologists in my ignorant manner, I think about, professional and patient in a one-to-one chat, almost with the leather couch mentality. Now, what you're describing is obviously quite a ways from that. You're looking at interactions with entire communities. Have I got that right?
You have got that right. Community psychology takes a very broad, systemic perspective on looking at the person in situ, looking at the person in the context of their social and environmental factors and what impact those play, the institutions, the family, have on the individual. And it really is a strengths-based approach. It's really not a medical model, it's a social model.
Now, is your predominant client then still an individual patient, or is your client a government department or a social body as a whole?
It can be either or. We could work with individuals. For example, I recently have done quite a bit of clinical work working with ex-offenders at the Australian Community Support Organisation. I've also worked with that organisation on developing strategic framework. For example, I've done a cultural competence framework for them, and I'm currently working with them on readiness as an organisation for National Disability Insurance Scheme services. So a community psychologist's role can, wildly fluctuate between an individual client, a smaller system, a not-for-profit organisation, or a government body, and can range from quite a strategic and management perspective down to policy or the provision of systems to manage projects, staff education, counselling, advocacy, and that sort of work. So group-based intervention, education programs, it's a very broad discipline.
It does sound like a very broad discipline. And is it a specialisation at a university level? Is this a master's level intervention? How does this work in the education system?
It is master's level. There's a Master of Applied Community Psychology course, and that's the one that's available through Victoria University in Melbourne. There are also doctoral programs, of course, as well.
And so it sits within the APS, the Australian Psychological Society, as a separate specialisation?
It does. There are a number of different colleges within the APS. There's a College of Clinical Psychologists, College of Counselling, College of Sport, College of Forensic, And community psychology is one of those colleges that sits alongside the others.
I see. Now, Helen, as a community psychologist, what's the biggest misconception amongst your customers, clients, patients that drives you nuts and keeps you awake at night?
I think it's what you mentioned earlier, in that the perception of psychology generally is about the one-to-one medical model, couch client, and that's all there is to it. Whereas there's so much more to community psychology and the sorts of social issues that we work on, from Aboriginal reconciliation, disability, drug and alcohol, child protection, domestic violence. They're the broad-ranging social issues that impact on our communities, and they're the broad issues that community psychologists tend to work with.
Helen, as you know, most of our audience are within the health system. If there's a message that you'd like to get across to practicing doctors and nurses, other clinicians within the hospital and health system, what would that message be? That
there's a real place for community psychology within the public systems, health systems, that community psychologists have a lot to offer, a very broad perspective, that we bring a broad-ranging skill set potentially to the sorts of social issues that people often present with. So when a client comes in the door, the client may have a multitude of personal problems and issues that need to be worked through, but they also come with a set of social issues and potentially social justice issues around where they've lived, who they are, what's formed their opinions, their value base, and I think a community psychology perspective can offer a different look at a person in their environment and bring a different perspective to things.
Helen, thank you for bringing that to our attention today. For those listeners who want further information, the Australian Psychological Society website, www.psychology.org.au, is the best place to go. A transcript of today's interview and a sound archive are both available on our website at www.hpr.fm. You've been listening to Wayne Buckler in conversation with Helen Killmier.